Good afternoon, and thank you for joining us for the Superintendent's Webcast on March 9th, 2020. As a reminder, this webcast will be archived for later viewing. Please make sure you forward this link to others in the school district that may have a need to watch it for the information contained in the webcast. Also, please email us your questions as you're watching the webcast. You can obviously do that as the webcast is ongoing live, but if you're watching this webcast in an archived version, you can still email your question to Go Soapbox, and we will continue to review those questions and provide those answers to you at a later date. The original agenda for today has been changed to focus slowly on the developing coronavirus issue. Today we're going to have an update from KDE Associate Commissioner Robin Kinney, and then we're also going to have an update from individuals from the Department of Public Health, and we're very happy that they are here with us today. We want to encourage questions. Please be advised that there may be answers to some questions you may have about this issue. We may have to provide those in writing at a later time, so those questions can be researched, but please feel free to email your questions to the gosoapbox.com address at the bottom of your screen. I'm also going to, at the end of the broadcast, just give you an overview of the email I sent last night to the extent that those topics are not covered. But without further ado, I'm going to turn it over to Robin Kinney, and she's going to go over several issues with you.
Thank you, Kevin. It's a pleasure to be here with you this afternoon. We are going to talk about the coronavirus. You probably have seen and heard much about it already. And I guess we want to assure you that what is happening here at the Department of Education is a coordinated effort with our local health departments, the Department of Public Health, and other agencies here in Kentucky. We do have people here with us today that can answer your questions from the Department of Public Health, and I can't stress how thankful and appreciative we are for their ongoing efforts to keep us informed and to be providing information to our local school districts. As you probably have already found out, the Commissioner has sent several pieces of communication out already in the form of memos to local school superintendents. And also, as we regularly do, we're keeping you apprised about this as well as other information through the Commissioner's Monday email that comes out, so you'll continue to receive updated information. And I want to make you aware of resources that are available to you. So the KDE Student Health Services team has developed a specific web page dedicated to COVID-19 or the coronavirus. And in our materials today, we have included a link that you can go to that. If you don't have your materials with you, if you look at the District Support Services web page, then you can also see that off of the Student Health Services provider section, and then we have important information there. Included on our website is all the recent guidance, and I will share with you that we have tried very hard to not duplicate information to you, and most importantly, not provide conflicting information for you. It's very important that we lean on the good guidance from the Department of Public Health. They are the experts as it relates to health issues in this matter. So you will see on our webpage a link to the Kentucky Department of Public Health and all their information. We also have links to the Centers for Disease Control, authoritative information from the national level, and information from the National Association of School Nurses. We also have information on there because, as you know, school districts deal with illnesses every single year. And while we want to encourage you to be extra diligent and being heightened in your efforts for precautionary measures, you do deal with things along this line from a flu epidemic type of situation. So practice your same things that you do when you're dealing with flu. We have out on our website a flu sample matrix. It helps you to assess the degree of flu within your district and actions you should be taking to keep your students and your employees safe and in school. I do want to put a plug in at this point when it comes to reporting of information. So in Info Campus, we already ask you as part of your regular duties to report flu-like symptoms. It's very important that you are reporting that as part of Infinite Campus. And sometimes we ask you to do things without a more thorough conversation on why we're asking you to do this. And so I'd like to share that with you, why we're asking you to do this, and it is so important. So when you have your school nurses or people at your school that are actually interacting with students and they see influenza-type symptoms, they don't actually make a diagnosis, but they share that with your attendance clerks. And your attendance clerks then code that in Infinite Campus. And what we do with that, every Sunday, we send that data and that information to the Department of Public Health. So it's really important, especially at this time, that clerks and school district personnel are reporting those flu-like symptoms. That does not mean in any way, shape, or form that is COVID or the coronavirus, but it helps us to gauge from a statewide level where flu seems to be most predominant. A few things to remember, and I'm sure my partners from Public Health will also share this information, but as of March 8th, 2020, there are 4 confirmed cases of COVID-19 in Kentucky, 2 in Harrison County, 1 in Fayette County, and 1 in Jefferson County. There is still a greater risk of contracting the seasonal flu by far stretches of the imagination, a lot more risk that someone's going to catch the flu rather than the coronavirus. But we do have information out on our website from the CDC regarding how you can continue to attack that flu. And I think even today we have a couple of school districts that are out today fighting the flu virus. As superintendents and local school officials, you deal with this every single year, and you are to be commended of the good work that you do when it comes to illnesses and making really hard decisions about your school districts, whether you stay open, whether you close, whether you're doing an NTI day. All those are decisions that you make on a very regular basis. Prevention practices include make sure you're getting flu shots. It's still not too late to do that. So please do that. If your staff, people in your building have not gotten that, please seek that out. Frequent hand washing. I can remember when I first started at the Kentucky Department of Education many, many years ago, and I was in a meeting and came out, and there were lots of teachers there. As we went to the ladies' room, they were all in the ladies' room, and I could hear them singing the ABC song. I could hear them singing Twinkle, Twinkle, Little Star and Happy Birthday. And that's all as a measurement and designed to teach their students about the length of time it takes for good hand washing. So I encourage you to continue to do that, which I know you already are. Always cover your coughs and sneezes with your elbow or a tissue, good practice to remember, and stay at home if you are sick. It is a very difficult decision because as providers, we want to take care of our students and want to make sure that we're giving them all that we can. But in this case, as with flu, if you are sick, please stay home. And also, if you're a parent or a guardian, a grandparent, and you have children that are sick, please have them stay home. I want to give you information on a very important upcoming webinar in addition to our discussion here today. There will be a community outreach webinar on the coronavirus on Thursday at 10:30 a.m. to noon. That's March 12th at the local health department. This is being hosted by the Kentucky Department of Public Health. And really, this is a wonderful effort for outreach for community partners to develop plans of operations for their agencies in the community. This really has to be tackled at the local level while we're providing support and guidance and direction and good resources. It's really going to be manned at the local level. The governor of Kentucky had a press conference this morning and really stressed the importance of that local community operations. We want those local communities to reach out and talk to each other, whether that's your local elected officials, school districts as partners, and also as you talk to your first responders and your health departments. It's really important that you're all speaking with each other and have a plan in concert to develop both on the preventative side and in the case that you should have a diagnosis in your area. Superintendents are encouraged to attend. If you cannot attend, it will be archived. This webinar will be archived for future viewing. But I do encourage local school districts to either a superintendent or a delegate from your central office to attend, because part of the purpose of this is to make sure that you are engaged as officials in your local community. We've kind of touched on this. Community partners will develop plans together. Again, I also encourage you to review any of the press conferences that the governor has had, because in the press conference this morning, Harrison County, Fayette County, and Jefferson County all participated, and they talked about certain steps that they had taken, both in a preparation standpoint and also since there has been a diagnosis in their area. Finally, if you have further questions about the health components, we've put up those links again to the CDC coronavirus webpage, the Kentucky Department of Public Health webpage. That is the most important email link I think that we can provide to you right now. And there also is a hotline, a COVID-19 Kentucky hotline, and other numbers for the Kentucky response team. Most importantly, please call your local health department, who can assist you in making decisions on the efforts in your community.
Thank you, Robin. Let's check to see if we have any questions coming in so far. Tony Cons is manning the Go Soapbox.
We do. So we have a couple of questions here. The first one, has there been any thought to allowing districts who currently do not have NTI days, allowing them to add those now?
That's a great question. Thank you for the question. We've been fielding that same or similar questions for the last 48 hours or so. As most of you know, I think 83 of our districts in Kentucky have been approved for non-traditional instruction, and that is governed by state statute as well as a state board regulation. And I believe in Harrison County today, they are closed as a result of the coronavirus issue. However, they are using, and I think they anticipate being closed all week, 5 days of NTI, meaning that they are providing instruction virtually or through other means for their students. And so those days will not be counted against them as far as having to make those days up. So school districts who have not been approved for NTI days, we are going to make arrangements for a waiver through the State Board of Education. I'm going to ask the State Board of Education at the State Board special meeting on March 18th to grant a blanket waiver to school districts who are currently not NTI districts, but who choose to go through an abbreviated application process, and that can show that they are able to deliver non-traditional instruction on days that they may need to be closed. May is the key word here. They may never need to use this. May need to be closed at some point during the remainder of the school year to be able to utilize the NTI platform. I can't say whether or not the state board will approve that waiver or not. However, that will be my recommendation. Dr. Kelly Foster has information, and her team leads up the NTI instruction project, and she can guide you through that, as well as Kay Kennedy. And I want to announce Kay Kennedy, is former department staff person, is agreed to come back with us on contract to be our coronavirus point of contact to kind of bridge various areas within the department. You can also reach out to her, and her contact information is also located in the PowerPoint.
Mm-hmm. A second question, do you have thoughts or guidance on out-of-state trips?
I'm going to wait. Drs. White and Drs. Meserly will be with us in a few minutes, and they may want to comment on the process that you would need to go through to think about how you would address travel and trips. I don't think there is a perfect answer to this. whether or not trips should occur, should not occur. But I want to defer that to them, and then they can provide guidance in that area. And then as if things continue to change, then we will obviously update information regarding travel as we move forward.
So a second question on the districts who are NTI but have already used most of their days. Any additional support for them?
Another great question. The 10-day limit on NTI days, meaning you're only allowed to have 10 non-traditional instruction days in a school year, that is governed by state statute. The State Board of Education has the authority to grant a waiver for state board regulations, but not state statutes. As a result, we are having conversations with individuals in the Legislative Research Commission and members of the General Assembly about possible changes to the statute, even if they are temporary in nature, and that could occur through language in a budget bill, to perhaps extend that limit for the purpose of districts needing to use NTI days as a result of the coronavirus issue. So that's a great question, and we are talking with members of the General Assembly about that.
We also have some questions about staff travel to professional learning opportunities, and then some other specific questions for the doctors.
Okay, so we have several questions for our doctors from the Department of Public Health, so that sounds like a great time to transition over for Drs. White and Drs. Meserly.
Good afternoon. My name is Dr. Connie White. I'm a retired OBGYN physician from Frankfort, Kentucky, and have been at the Kentucky Department for Public Health for the last 10 years. And I now serve in the role of Deputy Commissioner for Clinical Affairs for the Kentucky Department for Public Health.
And I'm Dr. Emily Meserly. I am a nurse practitioner, and I'm currently the immunization branch director. I am also a former school nurse, so I have that side.
When we were asked to come, I had every intent to put together a very slick, cool, and reproducible PowerPoint slide and PowerPoint presentation. And then we had our first case, and now as Robin said, we have 4 cases now. So I've got things on a piece of paper and don't have a PowerPoint to give you today. Robin did a nice job, I think, of explaining to you where we are in Kentucky. We have had 4 cases. We have done approximately we have 13 tests being run this afternoon. Our state laboratory started last week doing testing, and so if we get a specimen by 11 o'clock, we can run it that day. The problem is, as you've heard on the news, we have limited number, so we are not able to screen everyone. In fact, if someone thinks that they've been exposed and they have no symptoms, doing a test is not a good thing to do, because that could give you a false negative. You would think you're fine, but if you don't have symptoms, the test may still be negative, when in reality you could just not be symptomatic yet. So we're being very careful, so your clinicians can contact our epidemiologist and our medical folks at the state in order to see if this person might qualify. So 13 tests are being run today. 4 have been positive already, and she gave you the state, the counties. We've had over 100 clinician phone calls just since the governor's press conference on Friday afternoon, and over 250 patient calls. We do have a hotline number that was listed earlier, the 1-800, and I want to get my glasses so I don't read this incorrectly, 1-800-722 5725. This is a hotline that is staffed if patients, family members have any needs or questions that they can answer. So those things are all available to the public. And I love the fact that Robin also introduced the idea of flu. We are very excited that Dr. Meserly is with us now, and she is in charge of the immunization program at the Department for Public Health.
Thank you, Dr. White. So one of the things that I really appreciate that our partners at KDE brought up was you do want to use your influenza plans. You want to start by preventing the flu, by getting a flu vaccination, and it's not too late to get a flu vaccination. One of the things that I wanted to mention is most pharmacies, you can get a flu vaccination without a doctor's order. Pharmacists have regulation in the state of Kentucky to give a vaccine without orders, so that's a great place for you to go. And then I wanted to touch too on what our flu cases we've seen already this year in Kentucky. We've had 21,000 cases of flu. We've had 85 deaths, and 4 of those have been young children under the age of 18. So I really do want to drive home the point that getting a flu vaccination is your best protection, and you are much more likely to get the flu than you are the coronavirus at this time.
So I think the instructions or the recommendations we would make for our school team would be to dust off those special operation plans that you have already had, you're already using, and continue to use those for the coronavirus as well. Staying home when you're sick, I know that's difficult. Like I said, I was in practice for 20 years and I didn't get sick because I was a physician. And I know nurses are the same way. I know teachers are the same way. But staying home when you're sick and keeping your kids home when you're sick is, of course, one of the most important things. Cough hygiene that we spoke about. When you cough or sneeze, that spreads for up to 6 feet. And so that means it gets on all the surfaces. I think we don't, as medical professionals, don't explain why washing your hands is important. If someone coughs or sneezes, you touch that, then you infect yourself. So that's why washing your hands and I love the twinkle twinkle little star, that's so terribly important. And the CDC has got some really interesting literature that you can use in your classroom about making hand washing a game and trying to make that part of your school plan. I know you know how to do a school plan, but I just found those the other day and found they were quite fascinating. And then in the cough hygiene, as Dr. Meserly was coughing into her elbow, my granddaughter told me that my 4-year-old granddaughter told me I wasn't coughing into my elbow properly, and she showed me how to do it correctly, so I tried to learn from her. As you always do, alert your local health department about your absences. I know that's something that you do, and you're loading up your information from Infinite Campus. So that's the way you already communicate with your local health departments. This is a team sport, as Robin said and the commissioner said. So the reaction that we're having in Harrison County and we're starting to see in Louisville and Lexington is quite incredible because people do see that they're in this together to protect each other. Cleaning the surfaces, you're already cleaning the frequently touched surfaces like doorknobs and handrails, making sure you have plenty of wipes around so people can wipe off keyboards, telephones, those kinds of things. Something that I read about on the CDC website that it's not my world, so I'm not thinking about that, but the importance of watching for fear and bullying. Incidences we read hear about on the radio or read in the newspaper of children from a descent, whether it's Asian descent, South Korean, Italian. People are targeting those children, and so that's going to be a really critical thing for us to keep an eye out for. That has nothing to do with the disease process, but it has everything to do with developing our children. And so I just found that an interesting aspect that we need to add to our other long list of things that we're looking at with the coronavirus infection. I think now we'll switch to what happens if you do have an infection. Fortunately, as opposed to the flu that Dr. Meserly mentioned, looking at the data we have from China, which is where the bulk of the data is coming from now, the reason this is called novel coronavirus is the name of the virus that gives us colds. Novel coronavirus means this is brand new. Humans have never seen this virus before. And so since it is a new virus, we don't have science to tell us a whole lot. And so people are really working to try to give us, as in the real world, how do we take care of people? We are not seeing this infection in children to a very large degree. So I think you can get a lot of comfort from that as you're taking care of your children in your schools. If they are sick, it is probably either a common cold or they probably have some form of the flu. That being said, you probably are more concerned about staff because the staff member would be the one most likely to have an infection. So the first thing you're going to do, now we did have a kid come in today that we got a call about who said that they knew somebody that went on a cruise and they thought they should go home. I don't think that's probably positive coronavirus. I think that's somebody that wanted to go home and didn't want to go to gym class or whatever the reason was. So you want to be sure that you're getting a good history and finding out if there are caregivers in the home that might be exposed. If you have any question, you place a mask on that child and have them in a separate room, and then you can contact the Department for Public Health, and we can go over a more in-depth as to whether that child needs to be tested or not. If you get a call and you know you have a child, that's when the decision-making process that the commissioner was talking about. Do we close the school? Do we close that school building or do we close the district? Those are all going to have to be made on an individual basis.
It's very important. So in the there's a wonderful website called safeschools.gov, and the safeschools.gov website clearly indicates that CDC's recommendation is if you have a case in your school, one of the first things you need to do is contact your local health department. Again, we're focusing on regional collaboration, not specific schools as in principals or superintendents making decisions on their own. You want to involve the healthcare team and the public health team at your local health department to make a decision on what's best for that school and for that community. And that's why making sure that everyone in the community has a plan, not just the schools, the daycares where your children go to, the YMCA on-site daycares in the schools. They need to have a plan as well. So everyone needs to identify a person within their organization that touches your school children, how to deal with a positive case.
And one of the things that we are getting from the science is it looks like 14 days is a very comfortable incubation period. So if you have someone who is exposed and 14 days go by without an illness, then we're very comfortable that that person is not someone who you need to be concerned about anymore. So that 14-day window. If you decide you want to close for deep cleaning or something like that, that's a different issue. But if you're closing because you're concerned about the viral exposure, then 14 days is what is considered the incubation period.
Yes, because that mirrors the time that individuals are being quarantined, is that 14-day window. So that's very important.
So those folks that we get calls about that we're certain about, those folks are going, if they're asymptomatic, on a 14-day isolation. I know y'all have already talked about e-learning. We are working very hard at the cabinet right now. We have some very strict rules about teleworking, and we're trying to loosen those up so that those, if we get to a concern about infections in the workforce in our Cabinet for Health and Family Services, to be sure that we have the ability to do some teleworking. And I know y'all already are light years ahead of us with your e-learning. One thing that I think Dr. Meserly and I were talking about is if school is out, this is not spring break.
Right, exactly. When a district or a single school decides that they need to close because they've consulted their local health department, if your school or school district does decide to close, it's imperative that you indicate to those family members, those students, that yes, this is not mimicking spring break. It does not mean then let's all go congregate at the mall or go to the movie theaters or go to large public places of gathering. The idea is that really you stay home.
And if school is closed, then from what it's recommended from what I'm reading is that you would not have extracurricular trips, field trips, because that would again defeat the purpose of the social distancing. Social distancing is something that has been really heavily leaned on by the Centers for Disease Control and Prevention, and that's a 6-foot separation between you and the other person. So if you can have some type of a meeting or congregation where people can socially distance from each other, and the 6 feet is because that's the spray when you cough or sneeze, that's the connection that you can make with someone else. So social distancing is something that needs to be considered if there's meetings that have to happen, but you certainly don't want large crowds together if there is concern about an outbreak in your community. And we are talking about an outbreak in your community, so just because there has been a case in Harrison County doesn't mean that Henderson, Kentucky County, which is very far away, but they both start with an H, that doesn't, I'm not picking on you, Henderson County. I went to Davis County for college, and so I love that area of the state. But we want to be sure that we are not overreacting and using the data, where are these cases, the particulars to drive the decision making that we make. And probably the last thing that I wanted to bring up before we have questions, and we've seen that just from this last weekend, the local health department directors are really, really getting a lot of public pressure, as you are familiar with getting public pressure, to release who is this person, where are they. It just made my head spin, being a physician, and HIPAA requirements, and I've been around before HIPAA was a requirement. You just don't release that kind of information, and the professionalism of that. So that's going to be something that you're going to, as leaders, you're going to come up with your policy, and then it's ironclad. There's no wiggle room for this because of our concern about confidentiality, not only for students but also for staff.
All right, I have one last comment to make. So as a provider and a former school nurse, I do know that getting your immunizations up to date is very important to the school staff. So as you're encouraging your families to go out and get their flu vaccine to prevent the flu, which they're more likely to get, make sure that they touch base with their provider or their pharmacist to make sure that they're up to date on other childhood or adolescent immunizations that they need, because it's not just the flu vaccine that's preventing communicable diseases in the school setting.
All right, so along the lines of some of these cases, without providing, identifying information, some of the superintendents are just wondering, it would be helpful to lessen some of the panic to know if those who have been diagnosed with this virus, if they have improving health since being diagnosed, just to kind of explain, it does get better, et cetera.
That's an excellent point. And this morning on the press conference that the governor had, he did go over the 4 patients that currently have been diagnosed. One is actually at home, and 2 are in the ICU, and 1 is in the regular room, I'm pretty sure at this point. But they are all starting to do better. The problem is we don't have a treatment for this particular virus. It is a virus, and that's the nature of viruses. Unless you have a vaccination to prevent it, once you have an infection, all we can do is work on supportive measures, fluids, nutrition, oxygenation. We want to know these people have coronavirus for their family members and also for the healthcare providers taking care of them, because we want to be sure that we don't have a healthcare provider going from patient to patient who's not using full protection. So when you're in the hospital, the nurse or the aide that comes in your room doesn't have on goggles, a face mask, a gown, and gloves every time they come in there. If you have coronavirus or you have the COVID-19 infection, they will be using that type of equipment. So why don't we just use that equipment on everybody? We will run out of it, and we will not have it for our truly sick patients. So it is a balance that we're trying to do.
One thing to address is the face masks. The in terms of should schools have the face masks? What's the advice on that from the department?
So there is no, right now, the best line of defense in the school setting is hand hygiene, cleaning surfaces, staying home if you're sick, staying home if you have a fever, but there is no guideline by the CDC for the general public to be wearing masks.
Those masks are loosely fitting. They don't have the kind of protection in them to really filter out the molecules that would cause this. And what happens is, number one, it gives you a sense of security, which is false. The only person that really should be wearing a mask is if you think you have someone who's infected, you want to put the mask on them so they don't cough out and spread the virus. But wearing a face mask, it's uncomfortable. You actually end up touching your face more as you're trying to adjust those. I mean, I operated for 20 years. I know how uncomfortable those masks are, and when you're scrubbed in, you can't adjust those masks. So they are annoying to wear on a regular basis. So the mask will not protect you. And the only person really wearing masks should be healthcare providers that are right up in your face taking care of you, or someone you want to separate until they get a diagnosis.
So for talking about spread of the disease, one of the things that I would recommend specifically for those junior high and high school populations, the weather's getting nicer. It's prettier outside. Anytime that you could bring a classroom outside for instructional time, going back to the days of Florence Nightingale, open the windows. So that would be, if you're in a classroom and you have some students who are coughing and you're concerned, if there's the ability on your school campus to hold a class outside in the fresh air, that would be a really easy way to prevent transmission.
Kind of along those lines, and I believe that the answer to this is yes, but the question is, as a superintendent, can I release the information that each of these patients' health condition is improving? And I'm assuming, since the governor said that at the press conference, that is okay to disclose for these current 4 patients. Correct.
I mean, what you don't want to do is say, we're monitoring a child in Russell Street School, or White County School, or whatever the school is. You don't want to release identifying information because, as I said, I'm from Taylor County, Campbellsville. It's a small community, and it doesn't take long for people to figure out who that person is. So we want to give these people some protection and some protection from people figuring them out. But yes, saying that we had one student diagnosed, we've closed the school. They are getting better. They are healthier now. Odds are, if a child gets this infection, as we said before, many children that they're testing in China have no symptoms at all now that they're doing some massive testing. And if they do have any symptoms, they're very mild. So we do not expect children to have a bad outcome from the COVID-19.
From the health department's perspective, how many diagnosed and confirmed students or cases is considered an outbreak that would prompt a school closure?
Well, that's actually 2 different questions, because there's the epidemiologic definition of what an outbreak is, which really has nothing to do with this. I love to tease my nerdy epidemiologists, because they are, and so they have their rules and their cutoffs. There are no cutoffs as far as public health is concerned as to, if you have this many students that are sick, you close your school. That's an individual decision that each school administrator has to make. Depends on how many students you have, depends on where you are in the school year. Reasons that I would not have any way of knowing, and would not want to try to imply that I have the answer to that question.
And you make that decision with the guidance of your local health department. That's your local public health expert, is your local health department. So whoever is the medical director of your local health department, if you're thinking about closing your school, that would be the first person you contact.
And then going back to the student and staff travel guidance and recommendations, what would you recommend for travel? If there's field trips, spring break is coming up, you have a lot of professional development opportunities, teachers go on opportunities over spring break as well. Are you offering guidance for those?
No.
No.
My professional organization, I'm an OBGYN physician. I had a trip planned the end of this month to Savannah, and it's a virtual meeting now, which there's just something about virtually going to Savannah that's not really getting me excited. And we have our big national meeting is in Seattle the last week of April. It has not been canceled yet, but the vice president of meetings that went out there 2 weeks ago to organize the Seattle meeting is currently in isolation for 14 days because he was exposed to COVID-19. I'm sure that meeting will be canceled. There will not be 3,000 OBGYNs going to Seattle. I think every organization has to determine
Yes.
that.
Yeah, we had one of our epidemiology staff was to attend a meeting in Atlanta last week, and it was all epidemiologists. Well, they decided to cancel. That makes sense. So it's really going to be up to the individual organization to determine if they're going to continue that group activity. And as an individual, as a teacher wanting to go on travel, consulting your own primary care provider. You may have different health situations than your coworkers. You may be immunosuppressed. So always consulting your primary care provider about whether it's safe for you to travel would be a great idea.
I received an email this morning from someone that I don't know very well, but tell me that it's okay that my 22-year-old is getting ready to get on a cruise ship this morning and go on a cruise to the Caribbean. Well, the data that I know today is not going to be the data that's going to be happening in 7 days. It could be completely different, and I can't predict that future.
All right, I think we have a couple more questions for Kevin and for Robin, unless
Okay.
you have any other insights you'd like to provide.
Well, we're very excited that you invited us over today, and we would love to come back and do some follow-up as we have more answers, because this is an evolving coronavirus in Kentucky right now is not what it was at noon Friday. It's different, and it will change by tomorrow afternoon. So we will try to certainly be sure that we keep Robin abreast. I'm excited y'all are encouraging this meeting that we're having on Thursday. I think it'll be helpful, and if you can't watch, go to that archive, because I think you're going to see different aspects, different people, different ways that they're approaching this. You may learn some best practices from other folks, or you may want to share with us things that we can share with others. So it is a team sport, and we're very excited to be a part of the team with you. So thank you for having us.
Thank you. And not too late to get your flu vaccine.
Okay, so our first question, I think, will be for Robin. This is particularly with food service and I guess just specifically with Harrison County right now. How is Harrison County serving meals due to the school closing?
So as Commissioner Brown referenced earlier, Harrison County is out of school today from their regular school facilities and are operating under an NTI instructional day. We have received information from the U.S. Department of Agriculture on Friday about waivers of congregate feeding if a school or district is closed. Currently, however, an NTI day, as many of you are aware, is not a school closure. So they are still open. Harrison County has decided to go ahead and provide food service without reliance at this time on reimbursement under those food services programs that are funded by USDA. However, we are requesting a waiver, and we're requesting that today, to see if NTI days can be included so that you get a waiver from congregate feeding in that circumstance as well. Additionally, it's my understanding from my staff talking with Harrison County this morning that the way they're trying to approach it is they have set up a site at one high school and one elementary school, I believe it is, and they are looking for to have people come and pick up meals. So we have additional questions into USDA. Some of the questions that we are asking about is, even if we don't have congregate feeding requirements, how many meals could someone pick up? You know, as you all know, we provide food service for breakfast and lunch, and sometimes at-risk meals, which are after school. So we're exploring all those opportunities with USDA, and that waiver request has gone today to USDA.
And again, that waiver request would apply, if granted, to not just Harrison County, but districts that are similarly situated if they have to close and use an NTI day and choose to deliver some type of food service, that would apply.
Okay. The CDC recommends a school be out 14 days or longer with this incubation period if the student or staff member is diagnosed. Is there a plan in place at KDE to address this, especially with assessment being affected?
We're dealing with that and talking about that issue. I will say that as an example, tomorrow is the administration of the ACT, March the 10th. Obviously, Harrison County will miss that date. The makeup date is March the 24th, and we certainly hope that Harrison County schools will be back in session. For some reason, they are not and miss the 24th. We do have an emergency makeup day. I don't know the date. But I can tell you that at the department, we have contacted ACT, and we will ensure that any dates for ACT or other tests, we are working with districts in a cooperative way to make sure that we can accommodate them when they do get back into school, into session.
If attendance is lagging because parents are keeping students home over fear, is there discussion on how to deal with that from a financial point, as this could negatively harm district finance?
That is another area of concern that we're looking into. This is true not only with the coronavirus, but this has been a question that has arisen as it relates to flu, because we have had similar circumstances before you all have to make that really difficult decision about closing school or having an NTI day attributable to flu. We're dealing with the same circumstance. So we are having those discussions. We're having those discussions also with our legislative research staff partners. And at this time, we don't have that relief, but we are having those discussions.
Kevin, will the Board of Education have to approve the NTI application before the waiver is granted?
We're still discussing this internally. The idea that we have is that districts that anticipate wanting to come under the NTI program, and they're having those conversations right now because I've talked to several superintendents about it. We encourage them to go ahead and start putting that NTI plan together now. Kelly Foster's office will be reaching out to you with guidance. We're going to be providing a simplified version of the application process. And so the idea is that you start the process now of getting your NTI process together, knowing that the board will be presented with whether or not to approve that waiver to allow you to do that on the 18th. If they approve it, it would be retroactive back to your efforts right now, and hoping no district has to utilize that between now and the 18th. But if they do, we would interpret that as, and the board ended up approving the waiver, and you did have an NTI plan submitted to us, and the board approved the waiver, but let's say you took your NTI day on Monday and Tuesday of next week, then we would count that as an NTI day.
Okay, another question on that. Will a local Board of Education have to approve an application before it can go to the state board?
Yes, it would be a decision by the local board, just as any traditional, if you were applying for the NTI day, because that's important. You are committing certain resources of the local district to this effort. And so it's important that the local board weigh in. And anytime you're seeking a waiver from the State Board of Education, it does require local board approval of seeking that waiver, even if it's a blanket waiver. Mm-hmm. So we would need, and I know that that would cause, in most cases, a special meeting to be called of your local board, but obviously it's a very important thing that you're considering and could be very valuable to and useful to you to make sure we have some continuation of instruction during days that school had to be called off.
Does the department have any advice on the professional learning opportunities, staff travel?
I think this is a case-by-case issue. I will point to an email that went out last night from Commissioner, of KHSAA Commissioner about the girls and boys state basketball tournament. That was a very thoughtful analysis. They are working with the Rupp Arena and making sure there's sufficient hand washing stations and hand sanitizer and all of those things. Those are considerations. If you're having an event somewhere, talk to the event operator, talk to your local health department, because they are the experts in communicable diseases. So we want to make sure you really work with them, and they may be able to provide you and assist you with a thought process that you will need to use about determining whether or not you're going to proceed with travel.
I think that is it for now, unless you have any additional comments.
I again want to thank our partners at the Department of Public Health. That was an excellent presentation. Dr. Miller, Dr. Meserly, thank you so much. We will be having you back. We hope that we have you back at the April Superintendent webinar, and you can tell us about lessons learned, and this is all behind us. If not, we want to have you back there at the April webinar, and if things change and we need to have a superintendent webinar before our traditional April webinar, we will certainly have you back as well for needed information. I do want to really stress the importance of working together. Superintendents, you are leaders in your community. We know you have great working relationships with the mayors, judge executives, local health departments. It is critical that you meet with those individuals in a team approach to help you make decisions. That's exactly what occurred in Harrison County, as I understand from talking to the superintendent. And speaking of leadership, I want to thank Governor Beshear for his leadership in the press conferences and providing up-to-date, up-to-minute information. I watched the Facebook Live press conference yesterday. I could see from several comments there were a lot of school teachers and superintendents on there. That's a great effort. And I would say the takeaway, if you've watched the press conferences and listened to this webinar, the three takeaways, if I had to sum it up, would be stay calm, you're leaders in your community, and second, seek expertise from your local health department. I think we have said that over and over again, and apply a team approach locally. And as Governor Beshear said, wash your hands. So please make sure to send that message to your community. And as always, we're ready to support you here at the department. Thank you for everything you do every day for Kentucky's kids.
Thank you.